the day of Ross's heart attack, he was out biking, and it was his first day of training of the year to train for a bike race called the Firehouse 50. I was off duty on that day, and I had stopped in to the emergency room and was talking with some of the staff in the emergency room, and we were alerted that somebody needed help out in the parking lot, and Peg Lefebvre and I had responded to that request for help. And when I arrived at the vehicle, we saw an unresponsive male subject in the front seat of the vehicle.
Her doing what she did, you know, pulling me out of the back end of a car and starting mouth to mouth and CPR on somebody, you know, it's basically, it's kind of unheard of these days. But that just exemplifies what type of individual she really is.
We continued CPR outside until it seemed like the correct time to actually move him into the emergency room and continue our efforts inside the building. And after what seems like a very long time of working on Ross, he finally began to respond to our efforts and the medications. And eventually we then arranged for transport to another facility.
I didn't know until after I was awake and in the intensive care unit, and when I had an opportunity to talk to Dr. Peterson, and he said, well, you know, he said, you know, your heart took a pretty good hit. And I said, well, you know, I mean, what do you mean? He said, well, you know, they shocked you 9 times. And I'm like, ooh, well, I mean, that's a huge reality check for you right there. So, I mean, I knew that the people here, you know, really fought to keep me alive, because most facilities, and I work in medicine, don't shock people's hearts that many times. So, but it was explained to me later that I kept going in and out of atrial fib, and so when that would happen, that they would shock me again and bring my heart back into rhythm.
The care that was given to Ross that day is very similar to the care given to any patient on any given day. We've got the background and the training to carry out different procedures and cares, and whether the equipment is right there for you or not, you still have to do the best that you can with the abilities that you have in every situation.
Well, I think in today's day and age, you want to be on the cutting edge of things, and certainly I think that this place is. I know that I came back here for follow-up care with my cardiac rehab, and those people in that capacity, they just did an awesome job. They worked with me every day, and you know, listened to my complaints, and always had a caring ear to lend. You know, I was still very emotional and even shed some tears, but you know, I had one goal in mind, and that was to get back on my bike at some point in time, and they even allowed me to bring in my little trainer with my bike and kept me hooked up to an EKG monitor and monitored my heart and let me go as long as hard as I wanted to.
When I was able to meet with him after he was released from the hospital, he had looked me in the eye and said, I'm going to still race in the Firehouse 50. And so I had the opportunity to be able to go there and watch him take off on his bike and see him come across the finish line, and with his friends and family that participated in the bike race with him, and part of my family went with me, and it was just a very, in some ways, overwhelming, and some ways just a very exciting, nice time to see his whole family come across the finish line with him.
I was so grateful to have her there so that she could see me cross the finish line. It was a proud moment, I think, for both of us. I mean, I feel great, and I've done a bike race. I'm going to do a couple, 2, 3 maybe this summer, and you know, if it weren't for this facility, if they would have had to take me any further, or I would have had gone by ambulance anywhere, I probably wouldn't be here, or I wouldn't be in the capacity that I am today.
It's people who have serviced us for a long time, and right down to people who are new in this field. Emergency room techs, the people answering the phones, the people helping to facilitate for the helicopter, our maintenance crew who get the helicopter grounds ready for people to come in. Without all of the people involved, this happening and outcome could not be the same.